Thank you. Deputy O'Reilly.
Incredible that you wouldn't have told the Minister for Finance, but if that's your story you're going to stick to it, that's fine. Minister, in July, the National Paediatric Hospital Development Board was informed that you had accepted their memo requesting reappointment. These are the people who were in charge. So we now know the scale and the trajectory of the overrun was known to the Development Board, with the size of the overrun at 95, going up to 191, etc. by August. And in this period, you reappointed the entire board. Minister, when you reappointed the board, when you gave them that massive seal of approval, did you seek any advice on the performance of that board and the members? Did you discuss the results of the board's performance in relation to the project? And if you did not, will you accept that that was negligent on your behalf? And if you did, can you tell us who the hell was it that was backing this board? Because all of the problems arose on their watch and yours. You're supposed to be in charge. The board were supposed to be doing their work. As I've said, the trajectory of the overspend, as predicted, was only going in one direction, and yet in the middle of this, they get a massive endorsement from you as Minister.
Minister Harris.
Facts in relation to this. I took a decision to reappoint the board, as you rightly say, I think July 2018, that sounds right to me, the summer of 2018. And in my letter of reappointment to the board, I specifically referenced the fact that in this House, we would be passing Children's Health Ireland legislation, which would give me as Minister powers in relation to replacing that board, should I decide to do so. Now, you voted in favour of that. I don't think you brought forward any amendments to alter that reality, and you gave me powers at the end of 2018 in relation to that board that I didn't have in advance of that. I took the decision to reappoint the board in its entirety in terms of providing continuity for the delivery of a project. This was a competency-based board. You've decided, you've been judge and jury in relation to their performance now. This is a competency-based board appointed originally by my predecessors, by the Fine Gael Labour government, in relation to competent individuals who are doing their very best to deliver a major piece of infrastructure for our country. And I now have powers under Children's Health Ireland to replace that board, should I decide to do so. And I'll be led in relation to any governance or personnel changes by the PwC report. You've decided that the board has done a really bad job. The evidence to that is not yet been gathered, and I think we should actually afford people due process in that regard. This is a competency-based board. We often get criticised as politicians for putting cronies on boards. This was a situation where people with the professional qualifications required to deliver major infrastructure were asked to serve, and they did. I was pleased to reappoint them in its entirety, as you say, but I reappointed them pending the completion of the legislation in this House, and I made that very clear in my letter of reappointment to them, that I'd have new powers by the end of the year, and then I would decide what to do.